Yeah, mic check, mic check.
Why no go dey pick? Hello, hello. Is there a problem with that mic? Okay. Yes. Hello, 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 everyone, and good evening to this wonderful Tuesday session of the question and answer session with Dr. Rita Jabin. My name is Dr. Rita Jabin, and I am your host for this program, Ask Dr. Rita. And I'm glad that, thank you so much, Exclusive Kitchen, for joining. I'm waving at you. Thank you so much for joining. Yes, thank you for joining. Thank you for joining. I'm waving, I'm waving, I'm waving at you. Thank you so much for joining. Today we are coming on live, and I'm answering some questions. If you have a question, you can drop it on the comment section. I'm going to answer it. But um, this particular live session today, we're going to be answering questions on the impact of exercise on the kidneys, types of exercise to do, and then also I'm going to be answering, there's a special question that I got on impact of menopause on the kidney and what can be done. So today is the concluding episode for the kidney series, and from next week we're going to be talking about the liver. We're going to look at hepatitis, non alcoholic liver disease. Also, we're going to be looking at non-alcoholic liver disease, hepatitis B, things to do to care for your liver, and then we're going to be looking at herb reviews. So these are some of the things that we're going to be reviewing in the month of November in caring for the liver. But for today, I'm going to be talking to you about exercises, and we are live on Instagram. Thank you from Instagram. We're live on Facebook. We are live on YouTube, and we are live everywhere actually. So I welcome everyone to this special episode that we are having now. So I'm going to be shuttling between the pages to be sure that I am able to answer all the questions from all the different platforms. Thank you so much for joining. I truly appreciate your joining the session. I welcome everyone. So now let me go into my um, first question for today that I'm going to be answering. The first question from today is the question on menopause. I think I'm just going to take that question quickly because I wanted to talk about exercise, or maybe I should talk about exercises before I deal with menopause, since that's my main topic for today. But whatever the case is, I'm going to try as much as possible to deal with both conditions as best I can, as I can. All right, so let me just check on YouTube to be sure that my people there are not feeling left behind. So thank you for those of us on Instagram that have joined. Thank you so much. So I think I'm going to start with the menopause, the impact of menopause on the kidneys. Now, so menopause is not a disease. I need to say that menopause is not a disease, And being in menopause does not mean that you are dying. No. But menopause is actually just simply a stop in the reproductive cycle of a woman. So when a woman gets to a certain age, she has stopped reproducing. And this is mostly because of a reduction or changes in the hormone. And that's one of the reasons I'm talking about that's one of the reasons I'm talking about the impact of menopause on the kidneys today, which was a question that was asked during the week. I'm reviewing, okay, somebody asked a question, and the person asked that, where are my research sources? I always read out from research, where are my research sources? I decided to, start by saying that, so my research is not Google. So let me tell you one of the research sources, and which is one of the places I'm going to be quoting from this evening. I use the National Library of Medicine, which is a PubMed, and this is like a compendium of medical researches that are done, empirical researches that are done, and you have to be a subscriber to be a part of that. So because I'm a subscriber and I'm a researcher, I have access to some of this research, and I can use it in my educational teachings, and also as reference, especially when I'm referencing a scientific study. So I believe I've answered that question. So the impact of menopause. When does menopause start? Now, from the study that was done, or from the National Institute of Health, the library, it was different studies have been done from 2020 till 2024, and it's been generally concluded that menopause now starts at the age of 44, although it will be earlier than that, but from age of 44, this reproductive cycle in a woman would stop. So if you notice that at 44 your menses you are beginning to expect, so be expecting to have menopausal, premenopausal symptom from 44 years old. You know, doesn't mean that you may not be able to get, some people menopause extends, but now menopause is being shown or said to start at the age of 44. Thank you so much for joining. Official Barbie White, thank you for joining. Omaze and more, thank you so much for joining. And today I'm answering questions on the kidney, and the first question I'm answering is on the impact of menopause on the kidneys and what you can do. So all women, you are not yet in menopause, take advantage of this knowledge. You have mother that is already in menopause, take advantage of this knowledge, because we are seeing a lot of rise of kidney related problems even in aged people, and this study is saying that this is one of the contributory factor. Thank you, Joke, for joining. If you have a question, you can ask. So menopause has now been shown to start from the age of 44 years old. And one thing that you need to understand is that the hormone estrogen, it has a very important role in the body for a woman. And one of the key things that it does is that the estrogen is responsible for the protective roles of your blood vessels, and it causes it to relax or expand, generally because that's what, when blood is flowing through the blood vessels, the ability of the vessels to expand and relax is what you are measuring as your blood pressure, is the force that blood uses to pass through your blood vessels. So if you are even having hormonal imbalance, it could be a part of the reason why somebody, I need you to, I just said that in a passing, because some people are wondering, am I hypertensive or I have hormonal imbalance? As soon as they got diagnosed of hormonal imbalance, shortly after they began to notice that their blood pressure is not going down. And sometimes some people have high blood pressure, that the drugs they are using is not working. It's because of hormonal imbalance. If so, the person has hormonal imbalance, that can affect it, because estrogen, if estrogen levels are imbalanced, are too low, it may affect your arteries from relaxing and cause blood flow through your arteries to be more difficult than normal. So in the case of menopause, because of reduced level of arteries become weak, the arteries become inelastic, they're not as elastic as they ought to be. So the pressure that blood needs to pass through increases. And so we find out that women who are in their menopause, they are prone to having high blood pressure. Now, the study already links high blood pressure, persistent high blood pressure, to kidney-related problem or kidney diseases or chronic kidney diseases. So with menopause, with reduced hormonal levels, especially estrogen levels being very low, with the arteries being inelastic, that now causes the blood flow to the pressure of blood passing to be increased, and that can also affect the amount of blood that gets to the kidney, and also cause inadvertently cause kidney related problem. You see, so that's something that you need to take note of. Also, in menopause, there's a disruption in sleep. Either the person is experiencing small sleep, when I say small, not small sleep, sleep pattern, poor sleep, or short sleep cycle, or abrupt sleep cycles. So this reduced sleep function or sleep also directly affects renal functioning. So for anyone that is above, that is already in their menopause, their sleep and their sleep pattern is very important. If you persistently continue to have sleep disruptions, insomnia, sleep disorders, if persistently, if it persists for a long period of time, it may begin to affect the woman, affecting her kidneys. Also, during menopause, the urinary tract changes. Why? The urinary tract changes because of inflammatory reactions, also because of because of age. There's also now the bladder walls become more sensitive, and the tendency to be able to retain urine, hold urine for longer than when they were younger, is also affected because of the presence of because of menopause. So these are the impact that menopause can have. And then also to during menopause, someone has reduced immune activity, immune function. This reduction in immune function can also affect the body's ability to fight infection, making them prone to infection that they ordinarily or would not have had. Also, during menopause, some women begin to experience constipation, because these same things that affect the arteries also begin to affect the intestine. The intestines are not as elastic as they used to be. So what if you are in menopause? What are the things that you want to do? You want to make sure that you are getting natural sources of estrogen. Very important. You want to eat diets that will provide you with these sources, that will give you this nourishment. You want to have a lot of fibrous food. And you see, while it is, I always say to people, when you are already in your menopause, you are not looking for how to be drinking juice. You want to be eating whole food. You must have whole grains. You must have, your food must have fiber. You must have fluid in your diet. You see, these things are very important. And then you need to now look at the lifestyle that you are leading. Sometimes the lifestyle that people lead when they are much younger usually tells when they are older. The body is like a farmland. The thing you plant inside is what you will germinate. So when you are leading unhealthy lifestyle, when you use your young age to be smoking shisha, taking a lot of alcohol, these things are building up towards when the body gets older, they begin to tell. That's why you find a case of when somebody has gotten to a certain age, he has stopped a vice, stopped an activity for a period of time, and then the consequence of that is coming up maybe like 5 or 6 years after they have stopped, depending on how long that they were indulging in it. So I hope I've been able to answer the question on the impact of menopause on your kidneys. And if you have any other question, thank you, Joke, for joining. Isis Skinny Gold, thank you for joining. Oma, thank you for joining. I'm waving at you. Thank you so much. And for those of us on YouTube watching, thank you for joining. If you have a question, please drop your question. Thank you so much. Yes, thank you, Dr. Jabin. Thank you. Audio is excellent. Thank you so much. Bonaya, thank you so much. Yes, thank you. Vision designer, thank you so much for joining. So I just finished talking about, all right, Omar's thank you so much for your wave. Thank you so much. I truly appreciate. So you can, if you have a question you want me to talk about, please, you can drop it for me. I'm going to answer it. But now let me go into exercise. Exercise is something that I want to talk about. And what kind of exercise? Thank you so much, Omar's hair. Thank you. Exercise. Now, exercise is any physical activity physical activity that you do that increases your heart rate, is exercise, and that makes your muscle to work. Now, it also refers to activity that results in bodily movement. So this can be like your sweeping your house, cleaning, washing. All these can be considered as physical activities that can make you burn calories, cause your heart rate to increase, as well as also help you to keep fit. You see, gardening is also some form of exercise too that you or that people can do. However, well, I'm dealing not with this unstructured exercise now. I'm dealing today with structured exercise and the impact that it has on your kidney and what kind of exercise you should be doing. And I'm not talking off hard. I'm talking to you based on the studies that have been done. I took my time to look at the different researches that have been done. I'm going to be analyzing them to you. And I'm also going to be explaining the different types of exercise to you and what kind of exercise to do in certain conditions if you are dealing with certain conditions. Now, there are basically two categories of exercise I want to be talking to you about today. I'm talking to you about aerobic exercise and anaerobic exercise. I'm sure you have heard aerobic when you go to the gym. If you go to the gym, you hear them say aerobic, or you now hear I'm not anaerobic exercise. So I'm going to explain what these two exercises are, what the implications are, and how they can impact on your kidney, and what kind of exercise you need to do if you are concerned about your kidney. And then if you are diabetic also, I'm going to mention some of the kind of exercise that you should do that will be most appropriate for you. So aerobic exercises, these are endurance type of exercise in which a person's muscles move in rhythm. So in aerobic exercise, there's usually a rhythmic a rhythmic and coordinated manner of exercise, and it's usually for a longer period of time. So it's more sustained. So aerobic exercises are exercises that you can do for like 1 or 2 hours or 3 hours. They are more sustained. And one key thing about it is that it causes the heart rate it causes increase in the person's heart rate and the breathing rate, and it causes more oxygen to be supplied to the muscles. So key thing about aerobic exercise is that it causes release of oxygen to the muscles. So that's one thing you need to take note from aerobic. While anaerobic exercise, these are short, intense bursts of physical activities. Now, they are anaerobic because they do not increase the absorption or push of oxygen into the muscles. Aerobics cause oxygen to be moved into the muscles. Anaerobics do not cause oxygen to be moved to the muscles. So if you have a family history of kidney or you have kidney related problem, the kind of exercise that will be more appropriate for you is an aerobic exercise. It is an aerobic exercise. You want more oxygen to move into your muscles. You want more oxygen to flow. You see, this I'm telling you based on the studies that have been done. Real Money, thank you for joining. ODK, okay, Jack, thank you for joining. I'm waving at you. Thank you for joining. You see, so okay, Onome Oduga, thank you so much. Thanks for the enlightenment. Thank you so much for your feedback. So I'm talking about exercises and the kind of exercises to do if you're having kidney problem or you are interested in caring for your kidney. Now, this was a question that I have. This is a question that I got, I think 2 weeks ago, and I decided to take it as a topic on its own. What kind of exercises should you do if you're interested in your kidney? What kind of exercises should you do if you are hypertensive? You want to do an exercise that improves circulation, improves flow of blood. You need more aerobic exercise. Something that will cause your heart to push, that will cause your heart to pump better, pump faster, pump easier, that also would affect your arteries. Aerobic exercises. You see, I hope you are learning. Now, whereas anaerobic exercises, they lead to the buildup of lactic acid in the muscles. And so what is an example of an aerobic exercise for someone that is wondering? Walking is an aerobic exercise, dancing is an aerobic exercise, cycling is an aerobic exercise, treadmill is an aerobic exercise, jogging is an aerobic exercise, you see, swimming is an aerobic exercise. While anaerobic exercise involves high intensity. You see, when you are carrying weights, all those things that you are doing, they require a lot of so aerobic exercises actually. So before I even go into more further details, so what are you getting in anaerobic exercise? In anaerobic exercises, it is to strengthen, to tone your muscles, to build more. Actually, you're actually building muscle. You see, while for aerobic exercises, you are increasing stamina, and then you are improving circulation, stability. So one will give you stamina, one will improve circulation. So if you are hypertensive, the best kind of exercise that you should do is under the aerobic exercises. Now, what is the challenge that we find? You see, aerobic exercises are exercises that you can do for a long period of time, like 2 or 3 hours. You can run an aerobic race. But you see, anaerobic exercises, they are intense exercises that you do, but they are for short period of time. But what do we find that people do? People are doing anaerobic exercises for long period of time. They spend hours. You should not spend hours doing anaerobic exercise. You should spend hours doing aerobic exercise. When you do all of it, remember that you are doing muscular activities, you are building muscle, and one of the things that can affect your urine, the color of your urine and your urinary, because when you are building muscle, you are causing breakdown, all those things you are doing, it will cause urea, it will cause creatinine, which are byproduct of muscular activities. So if you already have a compromise or you are concerned, you please shift to aerobic exercise. Aerobic exercise will be more better for you. Now I have this 2023 studies that was done. I'm going to be reviewing it. So the study investigated between aerobic and anaerobic exercise. 2023, this study was done. By the way, I already told you that where I got the study from. So, and it was saying that the study was investigating what is the safe duration of exercise that you should do per week, that you will not be putting your kidneys under too much of pressure. And so let me read it. So it said the 2023 study investigated whether regular aerobic exercises reduce a person's mortality risk. Now the study found out that people who engage in a total of 1 to 2.1 hour to 2.4 hours of aerobic exercise 3 times in a week. 3 times in a week. So you are running your aerobic exercises. It's not that thing you go and do Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. You are doing excess 3 times in a week is what the study has shown. So don't let gym person push you to go and push your heart beyond the grade. And one thing you must understand is that when you are one of the signs that your exercise you are doing, no matter how intense it is, you must be comfortable. You must not be gasping for breath. You must not be finding it difficult to breathe. You must not be having chest pain or headaches or dizziness. If you are running any form of exercise and you are feeling uncomfortable, unease, you are feeling tired, please stop. Don't let them tell you no pain, no gain, no pain, no gain. My body and your body is not the same thing. So you can have exercise injury. So when you are doing no pain, no gain, no pain, no gain, you're going to have problem. There's problem. You see? So your exercise that you are doing, 1 to 2 hours per week, 1 hour to 2 hours, maximum 3 hours, should you do aerobics exercise 3 times. That means if I go on Monday, for instance, I can spend between 1 hour to 3 hours for aerobics. I should rest on Tuesday and come back on Wednesday. I should rest on Thursday. You see, so no more than 3 times. But what do we find? Christmas is coming. We want to jump from size 20 to size 12. So we want to lose all the kgs that we built in 3 years. We want to lose it. And then what do we find people doing? They are going to the gym. They are taking something to improve to alter their metabolic activities and their metabolic rate. What are you going to find? You're finding them having issues. You're going to find them having issues. You see? So if the study says that your aerobics should not exceed more than 3 times, and you can do between 1 hour to 3, maximum 4 hours. But while you are doing that, make sure that you are not feeling headaches, you are not feeling tired, you are not feeling dizzy, you are not feeling You know, you're not feeling tired, you're not feeling dizzy, you are not feeling uncomfortable, and you're not feeling chest pain or tightness of the chest. These things I'm telling you, if you are in any form of routine and you are experiencing this thing, this is your warning sign that you are going too much more than your body can take. So it's important that you take note of that. Now let me go on with the study. Excuse me. So the study goes on to say that, excuse me, it says people who practice strenuous, excessive exercise. Please listen to this study. People who practice strenuous, excessive exercise appear to have the same mortality risk as those who do not do exercise at all. So the person that is not going to do any exercise, that is just sitting at home and eating and just getting obese and having complication, and the person who is doing excessive, strenuous exercise, they have the same mortality rate. This is one of the reasons I decided to do this, to come. The study said that, it said people who indulge in excessive exercise have not conferred on themselves any added advantage, instead cause more disadvantage. Remember that this study, I got this from the National Library of Medicine. You see, and one of the things that this study is showing to us, is telling us, is that in this 2024, that people are more health conscious. We have a lot of people we are more health conscious, yet we have more disease, more kidney related problems now. Now that we have more health conscious people, we have more kidney problems now. Why do you think this is happening? Because of, Yoruba will call it Asheju Baba Ashete, too much doing. We are doing too much than we ought to do, you see. So this is affecting health. Now, the study also goes on to say that, so I'm already telling you how that the kind of exercise that is best for you to do. So I already said to you that, so the study said that, the study now shows to us that intense physical activity, remember that we are looking at the calculation of all your physical activity in a day, not just the time you spent in the gym. So you wash your car, you have burnt calories, you have caused your heart to increase, you see, those are activities. You know that people are not counting it as part of the activities. People are not counting as part of the activities that is contributing. So you finish going to do very strenuous activity, you still have a strenuous lifestyle. So all this put together is the aggregate that makes the person at risk. So I have a question from YouTube. The question says, good evening, doctor. Can farm work affect kidney? Can farm work affect the kidney, like weeding in the farm for a long period of time? Okay, so that is some form of fit, would even keep the person to be fit. And the thing with farmers is this, they rest when they are tired. Farmers don't continue, and farmers farm in the morning and they rest when the sun is out. So the way the farming is done in such a way that they are able to think is done. It's not done in such a way that it can become a channel of kidney related problem. What people can have from too much of farm work can now be bone related problem because of the repetitive activity of having to weed, or the bending down, you know, and the carrying of things. Then the lifestyle that the farmer is engaged in can now be what will put the farmer at risk. But because of that activity, no, farmers rest when they are tired, And farmers don't go to farm every day. They farm, they have a space. There's a way they do it. Today we weed, tomorrow we do one thing, next tomorrow, you know, so they know how they regulate it. I'm not such a farmer, you know, but, and I'm only reviewing scientific studies that have been done. But I can say to you that, of the truth, farmers lead healthy lifestyle. They eat well. Thank you so much. I am Omoyemi. Thank you for joining. I'm waving at you. Thank you for joining the live show. Thank you so much. You know, so I hope I've been able to answer your question, Mr. Buna. So in wrapping up shortly, I hope I've answered your question. If you have other questions, you can quickly just say, let me answer. So the thing is, farming will not cause you to have kidney-related problem. No. The study I'm reviewing is actually saying to you that you should 3 times in a week, then you should 1 hour to 4 hours per time that you do your aerobics. The study is saying that you should not do anaerobic exercise for 4-hour stretch every day. The study is saying that if you are doing that, you are not different from the person that is not living a healthy life. Does alcohol cause kidney problem? Yes. Yes. Studies have shown that has linked alcohol to kidney-related problem, smoking to kidney-related problem, smoking to kidney-related problem. Yes. You see, alcohol, because of the way people take alcohol, and then, you know, we're looking at the aggregate of this thing over a period of time. It's not that alcohol you drink once in 3 months I'm talking about. Is that what you are drinking every day? Is that beer you are drinking every day? By the time you do the cumulative effect, it is your kidneys that, and then what do people drink alcohol with vegetable? What is the lifestyle associated with alcohol consumption? Alcohol is best taken with pepper meat, pepper soup, pepper this, a lot of protein boost, protein burst. These things, alcohol has calories without any nutrients, no nutrients whatsoever. And then we now have some form of alcohol that are into herbal alcohol. These things can damage your kidneys. I'm telling you the truth. These things can affect your liver. I'm telling you the truth. Because it is undosaged. It is undosaged. You are just taking this thing. You see? So exercise. So today I've been talking to you about exercise. I started with menopause. I talked about the impact of menopause on the kidneys. And then I talked about the things that you can do. You have elderly parents. So you've been wondering, my mom was not hypertensive before. All of a sudden, she entered menopause, she's not hypertensive because of changes in estrogen level. The arteries are becoming, you know, inelastic. They are now becoming more rigid. Then you now have people who have high levels of cholesterol that also now further narrows the arteries, causing arteriosclerosis. You see, these things affect the kidneys. So I hope I've been able to answer your question. This is the last episode of kidney-related problem. I've been talking about kidney problems. I've talked about tests to do for your kidneys. Last week, I told you to go and do a test, ESR. I talked about the impact of the immune system, and I talked about agbo. Agbo is not, please, don't take agbo. So last year, at about this time last year, I was opportune to participate in a training in the University of Lagos. I think I still have the Arcadas. It's called Arcada. Trying to get the name. It's the African Center for Excellence for Drug Research, Herbal Medicine Development and Regulatory Science. You see, in the University of Lagos. I went to do that. And in the course of my study, a lot of plants were reviewed. Remember that this is University of Lagos, the Department of Herbal Medicine there. You know, African Center for Excellence for Drug Research, Herbal Medicine and Development. Oh my God, you'll be amazed. By the time, so next month, I'm going to be looking at the liver. Don't miss all of the teachings in the month of November, because a lot of these things, I'm going to be reviewing them. A lot of these herbs, a lot of these things from the findings from the study that I did in the University of Lagos, a lot of these things I'm going to be, I'm not even just going to be looking at from the National Institute, the National Library for Health, from PubMed, National Center. I'm not even going to be looking at institute research from the Institute of Biochemistry and Biomedicine. I'm going to be focusing on the research from the University of Lagos that professors in Nigeria have done with our plants here in Nigeria. So for agbo, plants have what you call toxic load. Don't be deceived. Don't let anybody tell you that no plants have toxic loads. That's your agbo that you are drinking. The toxicity test has not been done. The toxicity test to know the toxic load. It is the toxic load that helps to determine the right dosage. When the toxic load has not been done, the toxicity has not been done, how do you know that you're supposed to drink 1 cup? How do you know that you're supposed to drink 20 leaves or 30 leaves? And you will be surprised at the number of plants that can trigger cancer cells in a person. You will be surprised at the number of plants that can trigger liver, fatty liver. You know the number of fatty liver that is flying around. Are you not surprised that we are having kidney everywhere you turn? Kidney problem, kidney stone, kidney this, kidney that, kidney, everywhere kidney. What is the problem? People are more health conscious. People are turning to the herbs, but they are turning to goggle. They are turning to unregulated herbal substances. They are putting them. I am a naturopathic doctor. I use herbs, and I'm telling you that if you don't use caution, you will have the side effect of herbs, and it is bad. I remember when we were to register our products, we had to do toxicity. All of my products are NAFDAC approved. I didn't only just do toxicity test, I did efficacy test. Then I did dosage. We had to run tests, experiment these things before we were able to come up with the therapeutic dose to say 1 tea bag is the standard dose for. Thank you so much. Okay, I'm glad I've been able to clarify for you. Thank you. 1 tea bag is the standard dosage for an adult. And in all my, please, if you have not been following me, go and follow all my page, Ask Dr Rita Show, and make sure you turn on notification and you are watching my videos. I review herbs. I reviewed lemon 2 days ago. Can I drink lemon? Can I drink lemon? Do you know that vitamin C, excess of vitamin C is linked to kidney stones? If you will not let vitamin C rest, you are taking vitamin C supplement, you are drinking plenty lemon. All these things put together, these are water soluble vitamins. The body doesn't store it. You are overdosing. Your cumulative, the total that you take at the end of the day, the quantity you are taking at the end of the day, you done too much. It's too much. Let me speak pidgin, Joy. You done too much. You see, so these things that we are doing, when we do them once in a while, it's not the problem. The problem is that this is our lifestyle. You see the people that the lemon, what is the right, the lemon fanatics. They will carry lemon like this. They will cut plenty lemon inside big jar. They say, I'm drinking lemon water. Morning to night, they will add mint to it. I say, Oshe, did you go and study mint? Have you done the analysis? Mint is an aromatic plant. Go and watch the video that I've done. I've reviewed a lot of all these things. So, my dear brethren, I'm teaching you all these things because it breaks my heart. It breaks my heart to see people come to me with kidney-related problem. That is, if 20 people reach out to me, 17 is coming with kidney problem. I'm almost turning to kidney specialist as you are seeing me here. So, and by the grace of God, I thank God for God's goodness and mercy that is helping, for the patients, my patients, And I will say to you, I'm saying to you with all of my heart, with all of the love of God in my heart, this education, health education, the Holy Spirit told me, say, go and teach my people how to live well. He said, go and be a minister of health. That is what I'm doing. It's not, today Tuesday, I don't feel like coming live because all the things that have happened to me today, I'm like, I don't want to go live. But somebody needed to hear these things today to make a better choice. I'm here for you. I'm telling you these things. You see, I'm seeing, so it's not good to take agbo, and I'm telling you scientific study. I'm not telling you stories that touch. I'm not telling you stories that touch. So, what are the symptoms of what? I don't know what your question is. Damilola.ologun. You asked what are the symptoms? Do you mean symptoms of kidney disease or kidney stones? I'm not sure, but I'm just going to run through some of them. What are the symptoms of kidney problem? Symptoms of kidney problem could include tiredness. In fact, tiredness, frequent tiredness that nothing is relieving, sometimes headaches, sometimes bitter mouth, sometimes foamy urine, sometimes shiny urine, sometimes by the time his leg is swelling up, it don dey go far. Pain by your side like this, you see that pain that is at the side. Sometimes the pain can be heavy, sometimes it can be dull pain, sometimes it can be sharp pain. Sometimes the pain can radiate from that your side, from the back here. You can see me, I'm showing you. I don't want to be calling medical terminology. Yeah, you see, you can see me here. Yes, from your two sides, radiating down to your legs. Yes, sometimes these pains are there. You see, so these are some of the pains that, okay, yes. So sometimes they can be bitter. So when people are manifesting early stage of kidney problem, they are first of all treating malaria. It's malaria that they'll be treating. They'll be treating malaria and typhoid. They'll just notice, I'll be treating malaria. The malaria is when they are treating malaria and typhoid long enough that they did not see change. They will now go and do tests. Tests will now be telling them they are in stage 4 or stage 3B or stage 5 or, you know. And sometimes drug misuse compromise, excess protein intake compromises, alcohol compromises. We're looking at the drug. Sorry, my microphone for the YouTube people has gone off. Just a second. Is it better now? Okay. So, in the course of pharmacology, it's called a study in pharmacology. You look at, when you're looking at the drug, looking at drug action, drug reaction, you're looking at clearance of drug, you will see that. You will see in each drug, it is written on it, how long it will take for it. The manufacturer is telling you that it takes like 18 hours for this first statement to be fully cleared. You are taking another one. By the time you finish your course, do you know that antibiotics, at least I remember when I was doing I should plug the two. Okay, thank you. Sorry for that. Welcome back. Trying to make sure that people on YouTube can hear me well. All of you on Instagram, I'm sure you are hearing me well. Yes, but people on YouTube, all right. Oh, sorry, Sheung Yusuf. Sorry, I'm sure we have brought it back again. So I witnessed straight on patients when I was in Eco Hospital. Straight up a patient who came in and had a particular case and had to be on antibiotics therapy. You see, he had to be on antibiotics therapy because of that case. And while still in the hospital, he developed acute kidney failure. Side effect of the drug. That's it. I have a patient. In fact, today I spent a lot of time researching because of this particular patient. He's a very young boy. He's a very young boy. He's just 18 years. We're treating him for end-stage kidney disease. He has never smoked in his life. He has never taken alcohol. He has never ever done any of all those vices. He was not well. He went to the hospital, to the school clinic, and he was given treatment for malaria and some antibiotics. And he had a reaction, and the reaction caused his kidneys to fail. I'm not telling you story, I'm telling you a case that I'm handling right now. So antibiotics misuse, abuse, you need to be very careful. You can't just feel your body, you go to all night, you did not sleep well. Just go and buy paracetamol. No. Just go and buy pain relief and drink. No. These things have side effects. These things have side effects. And the more you indulge in them, the more you put yourself at risk. So I hope I've been able to answer your questions. This is a 30-minute live session. My name is Dr. Rita Jabin, and I am your naturopathic doctor. The naturopathist is someone that is certified, licensed to treat someone. And we use herbs, we use aromatherapy, acupuncture, to do treatment. I am based in Abeokuta, Ogun State, but I have patients and I treat patients all around the world. So you need my service, you can call the numbers showing on YouTube. You can DM me from Instagram, send a message to me, or you can call my number 070-6171-3985. That is 070-6171-3985. And I told you people last week to go and do some tests. I said do ESR test. Last week I talked about allergy and sensitivity, the impact of allergy or allergens on your kidneys. Look, you must know what you are allergic to. You must know what you are allergic to. Some people, the reason for which they have kidney problem is because they have eaten something that their body is reacting to, and that reaction attacked their kidney cells. They did not know. Please go and watch the video of last week. If you go to this page, you will find it is there. Go and watch it. You see, and every day I drop educational videos. This is not one of the pages on Instagram that you scroll past. You need to come every day and come and watch something and learn. And not only you, your family. And I'm going to round off by saying to you, do not give any what is your home remedy that I watch reading on Google. Don't give it to any child less than 12 years old. Don't compromise your children's health. Don't compromise it. Don't compromise your children's health, and don't compromise your family's health. See, make sure that you get knowledge. And that's why I'm doing this training every Tuesday. I'm live 7:30 to 8 o'clock. I'm talking to you about your health, about the things you need to do. And today, I talked to you about exercise. I told you the two types of exercises. I told you the exercise that is best if you are trying to care for your kidney. And I told you the advantage and the disadvantage. And I read to you a study that was done. And I told you the consequence of it. This knowledge has come to you free of charge. But it is not a cheap knowledge. It is not cheap knowledge. it is well put together knowledge that I've given to you. Because if everybody die of kidney problem, who are we going to have to live with? Who is going to come to our wedding? Who is going to be our friend? If everybody is sick and in chronic conditions, who is going to be our friend and our best friend? That's the reason I'm doing this health talk. So talk to someone today, share this video with someone, but take care of your health. Take care of your kidney. You see, your kidneys, they are very important to you. Don't deceive yourself and say, all die na die. All die no be die o. Don't see kidney problem, kidney disease. It should not come near anybody's home. I'm telling you the truth. Your kidneys are important to you. Take care of your kidney. Pay attention to what you eat. Pay attention to what you drink. The year is coming to an end. Things are expiring. Don't say it will expire next 2 weeks. Don't drink things close to their expiry date. Don't take things that are expired. Don't take expired drugs, and stay away from agbo and unregulated medications. Make sure that the things that you are taking, you check, you read, you check, and you understand that the person that is giving it to you have an understanding of your body and the potential allergy or something that you may be allergic to. I wish you well, and I hope that you have learned a lot from me this evening, and I'm going to be calling it an evening now. Have a good night rest. Bye-bye.